As a clinician working with patients, one of the stories that will always stick with me is the story of a 46-year-old female who is struggling with rheumatoid arthritis, as well as Hashimoto's, which is an autoimmune thyroid condition, and simultaneously found herself gaining more and more and more weight, was dealing with crushing brain fog, and actually had to take a leave of absence from work because she couldn't keep her eyes open to get through her day. And she came to me after seeing 6 different clinicians, all different specialists, right? She saw the psychiatrist, the primary care doctor, the neurologist, the rheumatologist, and essentially they offered her some medications, but all the medications had their own side effects, and she was exhausted and fed up of feeling poorly. And so she came to work with me, and the first thing we did was to connect, because that's the most important thing in medicine, is to have a relationship with somebody, to understand what motivates them, what are their values, and how are we going to leverage that information to help them get their health. And so we started with food, because we always have to start with food, and we slowly worked to change her diet. And this was removing inflammatory foods. And when you're changing food with people, you want to go baby steps. So we started by changing breakfast, and then lunch, and then dinner. And slowly we taught her how to eat in a way that was going to support her body. This in and of itself had an impact by dropping her weight and improving her brain fog. And then we started to think about the strength of her gut microbiome. So the gut microbiome has a huge impact on the immune system, and specifically autoimmune conditions. And when we looked into her gut, we found that she was actually chock full of low-level infections and was dealing with something called insufficiency dysbiosis, which means not enough good bacteria in her GI tract. So we worked to remove those infections, give her good probiotics, refeed her gut with lots of fiber. And as we did this, some of her joints started feeling better, and I saw her thyroid function improve. So her energy started to come back, her chronic pain started to go away. And then finally, we looked for kind of stealth infections to make sure there weren't any infections that were driving inflammation. Luckily, we didn't find any. And we topped this all off with a new approach on sleep, stress reduction, and handling her community in a way that supported her well-being. And in a course of about 9 months, she was back to work, feeling amazing, and still to this day is like someone that I talk to regularly, because she's so grateful that the life that she was able to get back.